Let's do some PNF, Proprioceptive Neuromuscular Facilitation, Stretching and Strengthening Techniques. The patient comes to the edge of the table with the sacrum right on the edge. The therapist stabilizes the foot with one hand, stabilizes the distal aspect of the femur, and push the hip into hip extension. Use the lead leg to lock in the distal aspect of the tibia to cause, allowing the knee to go into knee flexion, stretching the distal aspect of the quadriceps. The patient contracts concentrically and eccentrically in a slow motion as the therapist applies 10 to 25% of tension. The therapist will stretch again. You perform this exercise 3 to 4 times. Concentric, eccentric. Let me win, let me win, let me win. This is option 2 for a smaller person. They will use the back to stabilize the foot. Use both hands in order to bring the hip into hip extension and using that lead leg in order to cause that knee flexion to stretch the distal aspect of the quadriceps. Now the small therapist can use both hands in order to control that eccentric and concentric motion and even perform repetitions. This is the strengthening aspect where we're stretching the muscle and strengthening the muscle of the hip flexors. Stretch, strengthen, boom. Concentric, eccentric, strengthening, applying that 10 to 20% tension, and you will go for 20 to 30 seconds. Eccentric, concentric motion. This last PNF, strengthening and stretching techniques, is for runners. They'll be in a running position. The therapist stabilizes the calcaneus and the distal aspect of the femur. With the lead leg, stabilize that distal aspect of the tibia. Go into the stretch. Instruct the patient to fire hip flexion and hip extension at the same time, going in a slow motion using concentric and eccentric phase, opposite to each other, while the therapist move out of the way and move back into the position to cause a stretch. Once again, stretch the hip flexors and hamstrings at the same time. Strengthening the hip flexors and hamstrings at the same time. So we're strengthening and stretching using proprioceptive neuromuscular facilitation. We're inhibiting and facilitating this muscle, teaching it how to fire on a peripheral level and a spinal level in a controlled motion. Running position, strengthening, stretching, eccentric, concentric motion. You repeat this several times for 10 to 20 seconds.